We know there are many choices in internet radio, and the staff and host of LA Talk Live would like to thank you for choosing the internet's hottest destination for the most eclectic sound and invigorating talk. This is LA Talk Live. We are more than just talk.
Joshua Lane, member of the board of directors of Dr. Ann Wigmore's Hippocrates Health Institute, Josh Lane was part of the Dr. Ann Wigmore team that brought wheatgrass, sprouts, and raw foods to a worldwide audience. And now the host of Here's to Your Health on LA Talk Live, Joshua Lane.
Good morning. You're listening to Here's to Your Health on the LA Talk Live radio network. I'm your host, Joshua Lane, and we're here this morning with Eva Miranda from Brenda Watson's Renew Life Digestive Health Company. Eva, welcome to Here's to Your Health.
Hi, Josh. Thank you.
Nice of you to be here this morning. I appreciate it. I know you drove up from San Diego. It's very nice. Appreciate it. And so the Brenda Watson formula is a company based on digestive health. Is that not correct?
Correct.
And it's a national company.
Yes.
And Brenda Watson herself is a colon hydrotherapist, or was years ago.
Yes, she was a colon therapist and a naturopathic doctor.
And so what exactly is the Brenda Watson program?
Her program consists of anything to do with digestive care, and she has an acronym that she likes to teach people to use as a tool called HOPE, and it stands for High Fiber, Oils, Probiotics, and Enzymes.
Let me have that once again.
HOPE stands for High Fiber, Oils, Probiotics, and Enzymes, and if you take a certain amount of each, you'll be helping with your digestive system.
That sounds good, actually. It sounds very good. So what about the idea of fiber? What exactly is fiber, by the way?
Fiber is the bulking agent and the sweeping agent. So fiber consists of soluble and insoluble properties, and fiber will help to strengthen the colon. It will help maintain healthy blood sugar levels, help maintain healthy cholesterol, and it can also help with weight management. And fiber itself is going to clean out the digestive system by the insoluble property brushing using, like, think of a dish sponge, and the green part of the sponge is the insoluble fiber. It's the brush. The yellow part of the sponge is the soluble fiber component, which is going to absorb toxins and absorb impurities in the gut. So having both will help remove toxins and sweep out the bowel like it needs to and strengthen the digestive system, because the colon itself is a muscle. It needs something to push up against, to squeeze up against, so that's what's called peristalsis. And that will strengthen the colon for people who have a sluggish system. When the doctor says, you have a sluggish system, well, try to intake more fiber. And the best types of fiber are acacia, flax, oat, different fibers other than psyllium.
So let me have those once again.
Acacia fiber, flax, and oat.
Okay. So those are. So what about things like sweet potatoes? Is that fibers too?
Sweet potatoes have fiber. There's a great website that people can check out to find out how much fiber is in different foods called fiber35diet.com.
Fiber35diet.com.
And Brenda wrote a book called The Fiber 35 Diet, where you could get the book and check out how many grams of fiber is in a peach as opposed to chocolate.
And so what were the three fiber sources that you like to talk about again?
Acacia fiber, oat, and flax.
And acacia fiber, is that from a flower?
It's from an acacia tree, and there's acacia trees in Africa that are sustainably harvested. It's the sap from the tree, so the tree's never cut down.
Oh.
And it's a soluble kind of fiber. It would be great. The people who are dealing with high cholesterol should be on a soluble kind of fiber.
And so do you have those in the Brenda Watson formulas? Is it comes in a powder?
Yes. There's one called the clear fiber, organic clear fiber. It's an acacia fiber powder. It has no taste. It will not change the taste of liquids or your solid foods. It just mixes in well. It doesn't cause a grit. I actually snuck it into my grandmother's mashed potatoes when she was in the hospital, and she had no idea.
Aha. Okay. Usually it's good to inform people, but if it worked for your grandma, no problem. As long as grandma was happy with you. Is that over here? Do we have a copy of this one? Oh, clear. I see clear fiber. Oh, I see. Yes.
And people misunderstand fiber. They think that fiber is going to cause them to go to the bathroom. A lot of people think, oh, I can't do that.
Right.
I have them taste it and try it, and they get worried that they're going to go immediately to the bathroom. Well, that doesn't really happen to every person. And I don't know of that happening to anyone I've worked with fiber, where it causes them. There's no laxative in fiber that stimulates a bowel movement. It's a bulking agent, so it'll create a nice movement if you need it, but it'll also help absorb toxins and do a lot of other beneficial things in the body.
So in other words, the oat fiber that you mentioned in acacia, these are not herbal stimulant laxatives like senna. They're not senna.
Right. No senna, no cascara sagrada, not psyllium. Psyllium's a kind of fiber that absorbs 40 times its weight in water, and it can cause a person to get more backed up if they're already backed up.
I see.
And it's very damaging to the villi in the small intestine, the little hair-like follicles in the small intestine that absorb the nutrients from your food and supplements. Mm-hmm. If someone's continually taking psyllium fiber, they're actually causing a problem with the villi because it causes psyllium will cause it to get dry, brittle, and lay flat.
Oh, dear. And so Brenda feels that this is a much more contemporary and scientific formulation.
Sure. We used to recommend psyllium, but it really should only be used for only 3 days at a time, not really long-term use. I mean, a week would be fine, but when people get into the habit of doing it over and over again, that's when you come into the problem with the villi. And somebody with a chronic problem where they have something like colitis, ulcerative colitis, that type of fiber could be harmful to the body, or it could irritate, let's say.
Wow. Okay, so once again, let me have this clear formulation. What's in it again?
Acacia fiber.
Just acacia fiber.
Yes, is in the clear, organic clear fiber. It's all acacia.
And the other two forms you like to use are what again?
Flax, oat, and acacia, like a combination, like a triple fiber, or just flax with additional probiotics and L-glutamine and slippery elm. That's a nice combination.
Oh, which one is that you have over?
That's the Fiber Smart.
Okay.
It's great for a sensitive stomach.
And let me have that formulation just once again.
That has oat bran, acacia, and flax. That's a triple fiber. Right. The Fiber Smart has flax, probiotics, glutamine, and slippery elm.
And what is your thinking about L-glutamine?
What is my opinion on it? I love L-glutamine. It's my favorite ingredient. And we do have a product called Intestinu that has 5,000 milligrams per scoop. It's excellent if somebody has a chronic issue like any digestive disorder. They should take glutamine. And if they can't get a product, they can juice cabbage. I just don't know how much cabbage they should juice, but cabbage yields a certain amount of glutamine. And when we're stressed out, the reserves of glutamine in your gut gets robbed, and it starts to go to different places in your body, like your brain. When you're in a fight or flight response, glutamine will get taken from your gut and put into your other parts of your body to help protect those areas and feed the nourishment to those areas. But then you can develop things like leaky gut because the glutamine is getting robbed from your gut.
Yes, I find that in our profession of wellness, L-glutamine is a popular product. Many athletes use 10 grams a day or more. I actually use 10 grams a day. I do 5 in the morning, 5 at night. It gives me great focus, makes me stronger, makes me not hungry, and I know it's great for my gut. It's just great for the gut.
Great for the gut, for sure. It will help replenish and nourish and support the gut.
Oh, so Brenda has that. That does seem very contemporary. Glutamine is a great and important nutrient.
Exactly, because most of us are glutamine deficient, and we need glutamine in our gut. That's why you can go up to 10 grams a day with glutamine, because a lot of us are stressed out, and whether we're good stress or bad stress driving around in traffic, we are stressed usually daily on some level. And for people with IBS, that's usually a trigger where they get an emotional stressor, and that affects the glutamine as well.
What about the probiotic? Because probiotics seem very popular these days and enjoy a certain mainstream status that they didn't have even 5 or 7 years ago.
Exactly. Probiotics, pro means for, and biotic means life. And most of us need probiotics every single day unless we're fermenting foods and eating sauerkraut and kimchi and things like seed cultured vegetables. Those kind of things will bring you probiotics, but most people don't do that on a daily basis. And we need about 15 billion of probiotic every single day to maintain, because we are not eating organic every single day. Not everybody eats organic. And if you're not eating organic and you're eating animal proteins, you are ingesting the hormones and the antibiotic from that animal, and that gets tangled up in your body and affects your own bacterial balance.
Yes. And is this your probiotic over here? This one, this is it?
Ultimate Flora, 15 billion, yes.
Want to tell me about the formulation? So now, since people are using probiotics, why would they use this one vis-a-vis another? Why?
Well, the billion count is important because most in things like yogurt, we're not getting enough billion count. You'd have to eat like 18 cups of yogurt to equal maybe a billion count, and yogurt's been pasteurized.
Right.
These, in this particular program of Ultimate Flora, they're hardy strains, and we use multi-strains, so they don't compete with each other. They are the lactobacillus and the bifido strains, and if people need to know more about particular strains...
Wait, so lactobacillus and bifido bacteria have been shown that those work, right? Those everyone kind of acknowledges those work.
Yes. So, for example, if you want to know more about lactobacillus strains will reside in the gut, and that's where they form colony-forming units, and they thrive in the gut, in the small intestine specifically. So, if you think of L, think of little L, lactobacillus. L for lactobacillus, or little intestine.
Well, that's a good.
And then B, bifido, bowel. That way you know that the bifidobacteria will reside in the bowel. And that is excellent for someone who has any colon issues. They would want more bifidobacteria. But it's ideal to have both. If somebody's dealing with any kind of urinary tract infection or vaginal yeast, thrush on the tongue, or lactobacillus strains will migrate to the urogenital tract and do healthy things to that area, because when we are lacking lactobacillus strains, that's when harmful bacteria and pathogens can overproliferate, like candidiasis. And
the problem with candidiasis, that is principally caused by using antibiotics and birth control pills and cortisone-based medications. It was really a physician-induced illness, is it not?
Correct. I was someone who abused antibiotics, where I would take them and stop them and take them. And I was someone who had chronic urinary tract infections that developed into kidney infections, where the doctor finally looked at me and said, if you continue this path, you're going to be on dialysis.
Oh, my goodness.
I was really young. I was 16 years old, 14 when it started. And by the end of my high school years, I had 6 cases of urinary tract infections that became kidney infections, and hospitalized 4 times.
And you were prone to them because as a girl you were a heavy sugar consumer, and what was the origin of the problem?
The origin for me was taking antibiotics, because I was someone who didn't eliminate properly. I would have a movement once a week.
Oh dear.
And then that affected my lungs, and I didn't realize that. So I developed an asthma condition, and I would take antibiotics to handle, every time I would catch a cold, it would be a bronchial issue. And I had pneumonia 3 times, walking pneumonia and the regular pneumonia. But I've been on and off antibiotics, and then I would feel good and stop taking them, especially with the urinary tract infections. I just abused. I never knew the reason why you should continue to take the antibiotic. If you start one, it has to be finished, because you set yourself up for failure.
You made a very interesting statement. You said problems with bowel and therefore lung involvement. How did you ever make that connection, or did you learn that as you were an older person from studying with Brenda Watson? I mean, there's an interesting connection that most people probably couldn't make. When did you learn that?
When I turned 19, I met Brenda, and I went to her clinic and got a colonic. And after 3 colon therapy treatments, I was able to breathe without my inhaler, and I stopped taking the steroids that I was on. And
and how long had you been on those steroids?
I was on them for 6 months.
Wow.
Because it was getting more and more exacerbated, where I was feeling very old. My breathing was labored. I was gray. I was cleaning houses, and I had a lot of environmental toxicity going on where I was allergic to cats, plus all the harmful chemicals that I was using.
Sure.
Everything I was breathing in was bothered. Like I would clean out a shower, but I'd have the shower on high heat, and then the steam from that after spraying it with something like ammonia or Clorox would just attack my lungs. So I pretty much set myself up for having a issue with my lungs where the lungs were more sensitive, and especially because I was not eliminating properly. Once I started truly eliminating properly, my lungs got stronger. So yeah, that was my weak area, my lungs.
For those of you just tuning into Here's Your Health today, Eva Miranda is our guest with Renew Life Digestive Care Company, and I think the little past 5 minutes have been very remarkable. And I think that many of us today know things about our health that we didn't know 5 or 10 or 15 or certainly 20 years ago. So this connection that Brenda Watson taught you when you were 19, may I ask, so obviously it just clicked, it made sense to you immediately. Did it make sense to your parents and siblings, or were you the only one that it made sense to?
Oh, it's so funny. Well, the Chinese say that the lungs and the colon are connected. And once you clean out your colon, your lungs can clear up. And I explained that to my father, and I asked him, Dad, why didn't you know that I wasn't having movements? He goes, well, you'd go into the bathroom. And when I had this experience where I had met Brenda and I became better, I was so moved by that I wanted to become a colon therapist.
Sure.
And so I had my father come for my first day of school, and I also had him come in to see what it was going to be like to have a colonic after I was attached to everything, and then so he could see that this is a healthy thing. Colon therapy is as old as Egyptian times,
right? And
animals cleanse their colon.
And so your dad decided, it's a good thing.
Yes.
Oh, so has your family kind of gone in this direction now because of your experience?
Yes, they've seen my health improve, and they want to take care of themselves more so now. I've got them on fish oils.
Well, that's good. That's good. But even a great idea like fish oils, even great ideas need to be sold to parents. Because not everyone has a love of the subject the way you do, and so you can teach people, but they still need to hear the information.
Exactly.
So Brenda Watson, how many people has she graduated from her school? I didn't realize. I know that her products are in Whole Foods and they're national, and she enjoys a national reputation. But she seems to have helped a lot of people other than yourself as well?
She has countless amounts of people that she's helped that graduated from her school. I don't know the exact number. She's also reached out to people on PBS.
Yes, she's on PBS. That's right. Brenda Watson is on PBS. Yes. Was that last year she was on? She had a series?
Yes, she's done many PBS. Mm-hmm. One of them was the Hope formula with the fiber, oils, probiotics, and enzymes. Mm-hmm. And she also has one upcoming called The Heart to Perfect Health. Before, she had one on probiotics called The Road to Perfect Health, strictly on probiotics. That was the last one.
Right.
And now she's going to connect the gut and the heart, and it's called The Heart to Perfect Health.
Wow, that sounds good. You have to let me know that, and I'll announce that on the air before Brenda comes on to PBS. So now let's just also talk about, so we've talked about the probiotics. Let's talk about digestive enzymes.
Yes.
Good. What does Brenda like to use?
Plant-based digestive enzymes that will help break down protein, starches, fats, simple sugars, and digestive enzymes that will work in all pH ranges of the digestive system, whether the digestive system is acid, alkaline, or base, that the digestive enzyme will work in any of those areas. Some people need enzymes if they eat and they bloat, or a good way to know if you need enzymes, pretty much everybody needs to be taking enzymes because we eat dead food.
So too. Yeah, I think so too.
Yeah, we eat dead food. We eat things out of a bag, can, and a box, and nothing in there is alive. So if we don't digest our food properly, it will become toxic to the body. They're called endotoxins. And to prevent that, it's ideal to take a digestive enzyme so you can break down the protein so that it can convert into an amino acid so that could feed your muscles. Mm-hmm. And you want to take enzymes so that you can break down fat to make sure that you're not digesting fat, so your gallbladder isn't so taxed, or your liver. Right. And you want to break down sugar so that it can turn into glucose so that could feed your brain.
Right. And so, where are your digestive enzymes? Are these over here?
Digest More Ultra is a really great enzyme,
catching
a
that?
vegan vegetarian enzyme. If people, high potency, it's the strongest one on the market right now. It's great for people if they eat and they bloat.
So, what do you mean vegan vegetarian? What does that mean?
Well, it's all plant-based, so there's no animal byproduct in the product.
And so, what's in them again?
We have protease, amylase, lipase, malt diastase, invertase. There's a whole line of enzymes that break down proteins, fat, starches, sugars, simple sugars, fiber, and all kinds of different enzymes in that.
So everything we eat, this product will work on everything we eat.
Exactly.
And I take one with each meal?
Yes. I personally take more than one with a larger meal because I've had a history of health problems, so my digestive system isn't as ideal as your average person.
And yours is problematic based on what, in your opinion?
Being constipated as a child, and
excuse me, and so your mom and dad didn't really know and just fed you conventionally. Was that it?
Oh, yes. Right. I got to eat anything. I was always thin, so my parents didn't care what I ate. I would eat a whole box of ice cream sandwiches. I would eat all kinds of stuff, pizza, and then I would eat a normal meal, but I would eat it all together. And, that Fit for Life book is excellent because it talks about food combining.
Oh, yes.
That saved me with gas, because if you food combine, you can lessen the amount of gas that you expel.
Absolutely.
As crazy as that sounds.
No, I tell you the truth. On food combining, I actually personally and professionally recommend food combining, and I find it works. And I remember as a very young man, people tended to laugh when I told them that, but they don't laugh now. Now they're willing to listen, really. And that originally came from Herbert Shelton. He had a book called Superior Nutrition. And then in 1951, he made an excerpt of that book, which he called Food Combining Made Easy. And the first food combining came out in 1951. Because I had a copy of that one, actually, the 51. And food combining, an important concept, in my opinion, works really good, food combining.
I absolutely believe in food combining, and I recommend it to anybody who has a problem with gas so that they can help alleviate the painful gas that you might experience if you're combining dessert on top of a meal. Because proteins should be eaten by themselves with vegetables, and dessert should be eaten completely by itself. So if I ever have dessert, which is super rare, I have it before I eat dinner.
Aha. And Shelton has a very cute line. Shelton says, Herbert Shelton, dessert to desserts. Which is a kind of a funny old silly line, which I always thought was kind of sweet. All right, let me ask you then a controversial question.
Sure.
What is your position and the Brenda Watson position on the use of cow's milk products?
Well, I can't speak for Brenda, although I know that
yes, all right.
I do know that she is more into non-milk products. And cow's milk, I don't believe we can digest that very well. So for me, I'm allergic to the casein protein in cow's milk and cheese. Mm-hmm. So that a lot of people have a problem with that casein protein. I've actually done a lot of food allergy testing and found that out, and my lips would blow up, and I had this serious situation going on for 10 years where my lips would blow up and they'd shrivel up. It was like as if I kissed a hot stove, and it only happened to my lips, and then they would shrivel up, turn purple, and be very itchy. And once I got off of casein, any kind of milk product, I was fine. Once, specifically cheese.
And did any of your brothers and sisters or mom and dad have similar symptoms?
Well, my sister has an autoimmune disease, so I don't know if her autoimmune situation is due to food, but it's kind of all in the same family, autoimmune issues and having inflammation in the body and having your body try to protect itself, but then it starts to attack itself.
Right.
It's similar.
Have you had influence with the family? Is the family eating better, your family?
Yes.
They are? Okay.
I work with my sister on and off. She's involved and she's like me when I was taking the antibiotics. When she feels better, she stops her program, and when she's not feeling better, she gets back on track.
Okay. For those of you just tuning in today to Here's to Your Health, we have Eva Miranda from the Brenda Watson company. Brenda Watson products, colon health products are available throughout the United States. Whole Foods carries them, Lassen's carries them, Lazy Acres of Santa Barbara carries them, Vitamin Shop carries them. Everybody carries them because they are great products. Want to give us a website on that too?
Yes, renewlife.com.
Just renewlife.com.
Yes.
All
And
right.
Brenda also does a blog where you could go and ask her questions on brendawatson.com, and you can receive free newsletters. If you have any kind of weird colon issues going on, I would ask Brenda and, just see what she has to say.
And the question then about bowel health. So the average, this is, I guess, coming up a difficult question, but the average healthy person, how many times a day should the average healthy man or woman move their bowels?
2 to 3 times a day.
Right.
Ideal 1 to 2 to 3 times a day, but most likely 2 to 3 times a day.
So if people are eating, say, possibly 3 or 4 meals a day, then the scientific feeling, based on your work with Brenda Watson, is that people should move the bowels 2 or 3 times a day.
Yes. And, if you see a large bowel movement and you only have one of them and you can look at it and say, okay, that's how much food I had yesterday, then that would make sense too.
And do you find that this discussion of bowels, do you find that people, you do seminars, you visit stores, people listening to you now?
Yes. It's because of people like Katie Couric, whose husband died of colon cancer. So many people die of colon cancer and they should not have, because it's one of those cancers that can be predetermined, or they could have been prevented, if they caught it quick enough, and also if they did some prevention. For the most part, it would be something that you can prevent.
So it's not that we're offering a cure for colon cancer here, but you're saying that if a person moves their bowels 2 or 3 times a day, there's a lessened chance of colon cancer. Is that it? And a person who's constipated has greater chance of colon cancer? Is that a fair statement?
Fair statement, because toxins are being kept inside. And if you think about going on vacation and you left the trash in your house, what is the house going to smell like when you get back?
That does seem fair. That is fair.
When
actually.
you open the lid and it's been a month, what's going to be growing in the trash can?
Right. Yeah. Does anyone ever object to you when you speak that way? Do people say, "Oh, we don't want to hear that"? Do you run across that? Or
no
not
one
anymore?
ever has, and I've been very careful about how I talk about this topic, because for some people, it's just not part of their conversation. And
No, not usually. Right.
It was something that really changed my life to work on that area of my body. So I definitely am a proponent of keeping your digestive system under control and fed with fiber, oils, probiotics, and enzymes. That's going to nourish.
What have we not talked about here? We talked about the probiotic. Oh, that's a 10 billion. So you have different types of probiotics?
Yes, we have a whole probiotic line called Ultimate Flora, and we go from 15 billion to 200 billion. We also have a great
200 billion for a small family or for one person?
For one person. Okay. We have a great product called Advanced Immunity that has just Saccharomyces boulardii in it, and Epicor and Larch arabinogalactin. So it's going to help with the immune system. And Saccharomyces is the type of transient strain that doesn't stay in the body. Like I said earlier, lactobacillus strains will reside in the small intestine, the little intestine. Bifidobacteria will reside in the bowel. And so Saccharomyces will kidnap a harmful pathogen and take it out of the body.
Oh, I see. I did not know that.
It's
oh my goodness.
very helpful.
So how do you use that? Just sporadically?
You can use it sporadically. You could use it if there's some issue going on. You can use it preventatively. And it's one of those things. Saccharomyces is a thing that you can use when you are taking an antibiotic at the same time. It doesn't interfere.
I did not know. Okay, that's very good. That's very good. So we're chatting with Eva Miranda, who represents Brenda Watson with her Renew Life products, which are available nationally. Eva, you've been a delightful guest. Please give us the web address again so we can contact you and Brenda Watson.
Renewlife.com and brendawatson.com.
Eva, thank you very much for being a guest on Here's to Your Health.
Thank you, Josh.
And we are going to take a short break. And Here's to Your Health. We'll be right back on the LA Talk Live radio network after these important messages.
at the source since 1871, Mountain Valley Water is the deepest operating spring in America. This naturally alkaline water, with a perfect blend of minerals, has a crisp, clean taste that's twice been named best tasting water in the world. Mountain Valley Water has been served in the White House for 13 presidents, but it's also served kings, including Elvis Presley, whose only requirement on tour was 2 6-packs of Mountain Valley Water. Delivered to your home or office in glass bottles, Mountain Valley Water will give new customers in Southern California their first 2 5-gallon bottles free. For more information, call 1-800-499-9982 or visit us online at www.mountainvalleywaterla.com. Mountain Valley Water is the official sponsor of Here's to Your Health with Josh Lane on LA Talk Live.
Walk, run, climb, play. Solgar number 7 can help. Feel the difference for yourself. Solgar number 7 actually shows improvement in joint comfort within 7 days. Now you can start to get back on track fast and pursue the activities you love. Solgar number 7 is a breakthrough in joint care with no glucosamine and no chondroitin. The advanced bioactives in Solgar number 7 help to increase flexibility, mobility, range of motion, and actually shows improvement within just 7 days. 1 capsule once a day is all you need. When stiff joints occasionally say no, Solgar number 7 says yes. Visit Solgar.com and learn more about Solgar number 7 today. That's www.solgar.com, www.solgar.com. Solgar number 7, official sponsors of Here's to Your Health with Josh Lane and LA Talk Live.
Hi, this is Dr. Levi, your fitness doctor, making a personal house call, inviting you to join me Wednesday at 10 a.m. Pacific for my all-new show, The Dr. Levi Show. Join us as we discuss fitness, health, and well-being, including emotional and spiritual health. So don't forget to tune in to The Dr. Levi Show every Wednesday at 10 a.m. Pacific, exclusively on latalklive.com and the Talk Live Broadcast Network. You can also catch us on iTunes, Radio R&B, or watch us on Ustream.tv, or catch us on the Live 365 network, and now on Radio Flag and Stitcher Radio. Reality radio handcrafted for your listening pleasure. This is LA Talk Live, and we are more than just talk.
Hi, this is Kim.
And I'm James.
Inviting you to join us on our all-new reality radio show, Kick Your Assets into Shape.
Every Friday at 10 a.m. beginning June 29th.
Join us on the show that gets your money straight and your business growing.
So don't forget to tune into our show, Kick Your Assets into Shape.
Exclusively on latalklive.com.
You can also catch us on iTunes.com.
And like us on Facebook at Kick Your Assets into Shape.
Or watch us on Ustream TV.
This is LA Talk Live, reality radio handcrafted for your listening pleasure and more than just talk. We are your hosts, Kim
and James,
of the all-new reality radio show, Kick Your Assets into Shape.
Which boot you gonna use, babe? The steel toe or the pointed one?
No boots on this show.
Oh, man, dang.
Joshua Lane, member of the board of directors of Dr. Ann Wigmore's Hippocrates Health Institute, Josh Lane was part of the Dr. Ann Wigmore team that brought wheatgrass, sprouts, and raw foods to a worldwide audience. And now the host of Here's to Your Health on LA Talk Live, Joshua Lane. Hi, this is Raphaele. I'm usually a guest with Josh Lane, but today I'm the host, just for a moment with Kristen Hopper, who is a friend of mine. and we met approximately a year ago.
Yes.
And you're the senior director of the Los Angeles Center for Women's Health at California Hospital Medical Center, right?
Yes. Yes.
And we met because of one of the doctors who worked there, Jennifer Kegel, right? Because she's very fond of one of our medicine at Boiron, which is arnica for bruises and swelling, and she's a plastic surgeon on top of being a lot of other things, and that's how we got in touch.
Yes.
And I remember at that time you gave me a tour of the center, which was like an empty shell.
Yes.
Right? So now it's totally different. So beautiful. You did such a great job. I really love it. It's a very different feeling.
Yes.
So you're here to explain a little bit what you do at the center, and also I think one of the missions is really to educate women.
Absolutely.
So if you can tell us a little bit about, I don't know, how many doctors, what you're doing.
Sure. Well, our center, the Los Angeles Center for Women's Health, is about a 16,000 square foot facility in downtown Los Angeles on the corner of Venice and Grand. It's part of California Hospital. And our purpose, our mission, is to improve the health of women in the prime of their lives. And that includes a very holistic approach. So it's not one body part here and one body part there, but treating the woman as a whole.
And that's what
body.
Makes it different, right?
Yes.
From what we already have in LA. It's pretty unique.
Yes. So you don't have to go one place to get a mammogram, another place to get your pap smear, another place to get your blood drawn, all those kinds of things. That the objective is that everything's in one place because your body is actually one thing.
One thing, yeah. And you even told me that, I don't know if it's on already, but you want to make yoga lessons available. So this is
we're starting that in the fall.
Maybe a spa later on.
Yes. Again, the whole body, from wellness to acute and chronic disease, trying to prevent and heal that full spectrum of issues. Yeah.
And it's a very, last time I came, it's very soothing, it's very beautiful, so it plays a role also.
Absolutely.
For women
Environment has a lot to do with healing.
Of course.
Yes.
And so you see women who are healthy and women who are sick, right?
Yes.
And what kind of doctors do you have? What specialties or services do you offer?
We have a breast surgeon, we have gynecology, gynecologic oncology, a menopause specialist, cardiologist, plastic and reconstructive surgery. We have a nurse practitioner as well. We have a full-time radiologist who only reads breast imaging, which is very important. Yes.
Well, we'll talk about that too.
Yes.
Yeah.
Yes. And as you say, part of our objective is education.
To educate.
And providing information to women. There's so much information, and it's just hard to keep track, and there's so much new research, so it's challenging to be at the forefront of all those things. Yes.
So but you're here for that. So tell me, we were talking a little bit before the show, and I learned things already just talking with you, but what are the major health issue for women that we're not necessarily aware? Of course, I'm thinking of breast cancer.
Yes.
But you were saying that there are other things that we should think about.
Well, what we're all aware of and sensitive about is breast cancer, and that's definitely a concern. But the other two big areas that are more impacting, but we're less aware of them as women, is cardiac health and osteoporosis. So in terms of from cardiac health, it is the leading cause of death in women.
Oh, it is.
It kills more women than men.
It kills more women.
Absolutely.
Yeah. Do you know why? Is it because we don't think about it, or
It's partly we don't think about it.
Yeah.
Secondly, the symptoms of heart disease are slow to evolve. But also from acute death, when people die acutely from heart disease, from a heart attack, heart attacks manifest differently in women than they do in men.
Yeah, that's what you're talking about. So surprised, because for me that was the typical pain in the left arm.
Yes.
So how is it for a woman?
So a woman will often feel just anxiety, will feel jaw pain or shoulder pain, feel like flu-like symptoms, just kind of achy. And so it's not often the acute pain that a male will experience.
It's spectacular.
Yes. Yeah. And so it might go on for a day or two. You don't really even realize it's happening. And so even when women do realize, something's not right, and they go to an emergency room, describing those symptoms sounds like lots of other things. So it's often not recognized as well by the physicians, because they're still thinking of it as the sharp left arm pain and chest pain. So we need women to be aware of these other ways that a heart attack might appear to them, and we need to help our physicians understand that those are also indications of a heart attack, primarily seen in women.
And that's why you have a cardiologist on staff,
Absolutely.
right?
Yes.
Anything we can do to prevent that from happening?
Yes. So the good news about heart disease is it's mostly preventable.
Okay, that's good.
There's certainly some genetic component to that, but the most important thing, of course, is if you smoke to stop smoking. Okay. This is the main thing for most.
Would
things.
that be? At one point I heard that women started to have more heart problems because they smoke and drank more at one point, as opposed to maybe 50 years ago it was more male thing.
It's possible, or maybe it wasn't recognized.
Maybe
had the heart attack. Yes. So healthy
smoking,
diet, quit smoking, healthy diet, and exercise.
Okay.
Really, the main things that we can do.
What kind of exercise? Like something intense, or
running, walking, swimming, getting your heart rate up. Your heart is a muscle, and just like your leg muscles or your shoulder muscles, you need to work out your heart muscle, and the best way to do that is with some intensive exercise to get your heart rate up.
Is that something you should talk to your physician about, how to exercise, or just regular workout is okay? Or
There's a whole host of things that we can all do. Certainly, if you have been sedentary and you want to change that, it's a good idea, absolutely, to include your physician in that planning.
Okay.
Yes.
So exercise is good. Diet, good diet is good for everything anyways.
Absolutely. And it's very important for your heart health.
So, and what you said genetic, right? There are some factors we cannot do anything about.
True, but which can make us more predisposed to having heart disease. But the other thing that women need to be aware of is that the medications that can control and manage heart disease are also often not as prescribed as they are for men.
Okay.
So the statins and the anticoagulants are more readily prescribed for men than for women. So again, it's just we need to work closely with our physicians to say, hello, please, maybe do we want to consider these, and be more engaged perhaps in those conversations.
And more aware that it's definitely a big issue for us too, unfortunately.
Yes.
So we said, we went over we talked a little bit about breast cancer, and I know it's a big thing for the center. Also we talked about what you can do to reduce your risk for heart disease. What about breast cancer?
Yes. Also, again, a healthy diet and exercise. Studies have shown that 4 hours a week of exercise can reduce your breast cancer relative risk by almost 40%. And even just 2 hours a week can reduce your risk by 20%. Okay. So it doesn't take that much, and it can have pretty significant impact for multiple things. But in particular, there are several studies recently indicating how this exercise can reduce your breast cancer risk. We think of it maybe for heart disease prevention.
I didn't think about it for breast cancer, never.
Yes.
No. And that's, diet, I heard about broccoli.
Yes. Cruciferous vegetables.
Oh, that sounds yummy.
Yes. Kind of the stringy vegetables, broccoli, cauliflower, asparagus. A diet high in those vegetables has also been shown to reduce your breast cancer risk and also to reduce the recurrence of breast cancer.
Oh, excellent.
Yes. Yes, and I think the other important thing for us to be aware of is that while cardiac disease is quite preventable, we tend to think that breast cancer is not very preventable.
Like death sentence.
Yes, and it just happens. But certainly a lot of it is sporadic, but there is a fair amount that you can control your risk. And the other big thing is, even if you get breast cancer, it doesn't mean you're going to die from it.
Okay.
And the important thing is to get screened, to get your mammograms. The biggest improvement in reducing death from breast cancer is early diagnosis. So this is what we need to focus on.
Yes.
And there's controversy lately about when to get a mammogram, who should get a mammogram. This is for you to work out with your physician and to decide. Your physician can help you with this. And part of that, it depends on your risk.
Of course.
But if your cancer is found when it's below 1 centimeter in size. So a penny, a little dime, perhaps a dime. There's about a 92% 5-year survival.
Okay, which is good.
Which is quite good. So versus if it's when it's 5 centimeters,
so it's a big one. Yeah.
A big, you know, there's about a 63% 5-year survival rate. So with self-examination, you can typically feel a lesion that's just about a centimeter.
Okay.
So about the size of a pea or the size of your pinky fingernail. But a mammogram can find this when it's
smaller.
1 to 2 millimeters.
Still, you do recommend the self-examination?
Well, combined with mammography.
Okay.
Sure.
And you teach it at the center?
Yes. Yes.
Because it's not always easy.
No, and it helps the position that you're in and this kind of thing. And our nurse practitioner and our breast surgeon, Dennis Holmes, who's also our medical director.
I met him last time.
Yes. And they do what's called a clinical breast exam.
Okay.
And so they're better at doing this than you and I probably are. So,
but in between visits, maybe it's a good idea to do it yourself, just to check.
Even to be more familiar with your natural anatomy, so to know when something feels different.
So would you say it's better to keep the same physician because he knows what your tissue feels like, or is it better, or is it
I think
a lot of women switch?
Yes, I think the most important thing is having a healthcare provider that you really connect with.
Okay.
So just staying with someone for the sake of longevity is probably not necessarily your best avenue. But in terms of breast cancer, the most important thing is the mammogram.
Okay. And the person who reads the mammogram. That's what you told me off the air, and that's true. I thought they were all, the same.
Yes.
But they're not, right?
No, they're not. So I think a mammogram is a mammogram. There are two types of mammogram machines.
Okay.
There's an analog machine and there's a digital machine.
Do you have both?
We just have digital.
Okay.
So digital is the latest technology. There isn't a lot of data showing that there's a big, let's say, reduction in deaths or things like that from getting digital mammograms versus analog. But when you just look at two images side by side, it seems clear that if you were a radiologist, you would rather be looking at digital films. The clarity is much greater. Plus, they're much easier to share.
Okay.
The image. So if you go get your mammogram and it's a digital,
you can email
then you can. They're very large files, so it's a little hard to email, but they can certainly be put on a disc and taken to other places, and they can just be looked at on the screen versus a piece of film that's a little bit more challenging to share readily.
Of course.
And then the other part, as you mentioned, is who actually reads your mammogram. So as you say, I think most of us think, well, what's the big deal?
Yeah.
It doesn't matter.
It's there or it's not.
Yes. You see it or you don't see it. Looking at a mammogram is quite different than looking at, let's say, if your ankle is broken or if your wrist is broken. You can see it. It's cracked. It's bone tissue. You can see that that's different. Looking at soft tissue is much more challenging. It's grades of gray. It's not black and white.
Yes.
And so it's very helpful to have a physician, a radiologist who specializes in breast imaging, and this is all that they do. They're just the frequency, the quantity of images that they look at helps to improve their expertise.
Yes. And you said that's what you have.
We do.
Yes.
We do. David Brousseau is our radiologist, and this is all he does is breast imaging. And we've had several patients who come and say they feel much more comfortable working with him because he's so expert at the anatomy and can readily identify when he sees something on the film, if it's something to be concerned about or not to be concerned about.
It's experience and skills, I guess. Yeah.
Yes. And the other part is if there is something found on your mammogram and then you're going to have a biopsy, the radiologist is the person who biopsies it, and so they use the mammogram machine, they use the ultrasound machine to guide how they get your biopsy sample. And again, the more familiar they are with that equipment and how the images look, and the more of these biopsies that they do, the better they are. And what you want is that the physician gets the tissue and in the most minimally invasive way.
Yes.
So you have less scarring, you have less pain. all of these things. So again, you just want someone who this is all they do.
Yes.
It's sort of like your car. If you have brand X, you want to go to a mechanic that's what they do is brand X. Yes.
It makes a lot of sense. And if you mentioned that you have a surgeon, plastic surgeon, so that means that they do the reconstruction.
Yes.
If you do have to
yes
have surgery, they do the same day? Or it depends?
It wouldn't be the same day because
Okay.
there's a lot of planning that needs to go involved and go into that. But the other part that's important about that, for one thing, it's best to have a breast surgeon who does what's called oncoplastic surgery.
Okay.
Meaning and Dr. Holmes does this, but meaning that he can remove the cancer and address the cosmetic component at one time.
Okay.
If the cancer is too large and he has to remove too much tissue, and so there's going to be a separate surgeon, a reconstructive
Gotcha.
surgeon involved.
Okay.
The part that's important there is that these people actually talk to each other before the surgery.
Yes.
And one thing we do is every breast cancer case that we identify in our center is reviewed by an interdisciplinary board. The breast surgeon, the radiologist, the reconstructive surgeon, the medical oncologist, the radiation oncologist. The whole team works together in advance to come up with what seems to be the ideal treatment plan and works with the patient to say, this is what our team has found. And there are studies showing that recurrence rates are lower when you have this team approach.
Oh, really?
Yes. So this is another important thing. And I think also as women, we just think, well,
It's
if
just
you just
easier,
take out the
yes.
breast cancer, what's the big deal? But it is a big
not
deal.
as simple, yeah.
Yes.
But I meant it seems so much more comfortable to be in the same place and
Yes.
with the team as opposed to go from,
Yes, from everything, from the nurse that you deal with, that's going to take care of you for your whole treatment. It just helps, again, with the
Yes.
healing, with
the anxiety.
Yes.
Yes.
Mm-hmm. Yes.
That's excellent. And so oh yeah, I heard it's something that's, I don't know if it's new, but I heard about, maybe genetic being involved in breast cancer.
Yes.
What do we know about that? Is there a way?
Yes, about 10% of breast cancers are related to a genetic mutation.
So it's not that much. I thought it was
It's
more
not
than
that much, and that's the other thing not everybody has this mutation, and
Okay.
even if you do, it doesn't mean you're going to get breast
That's
cancer.
interesting. Yeah, that's important.
So over our lifetime, an average, around an 80-year lifetime, women have about 1 in 8 women will get breast cancer. Okay, so about
Okay.
12% of women will
Okay.
get breast cancer at some time in their life.
Mhm.
For women who have this, it's called the BRCA, breast cancer 1 or BRCA2 genetic mutation, which means they don't have the natural tumor suppressor cells. So
Okay.
you don't have the natural ability to control rapid cell growth. Okay. And I'm certainly not the expert on that,
No,
but
but
enough about it. I can say yes.
Yeah.
That about 60% of women who have those mutations will get breast cancer. So it's a lot, and it's definitely to be concerned about. But it's not a guarantee. If you have this mutation, you will get breast cancer.
But you need to watch it more.
You need
right?
to be more aware, and you need to work with your physician to come up with a treatment plan for you. There are drugs such as tamoxifen that can be taken that can control this as well. Women can have a prophylactic mastectomy.
Okay.
So there are options. It's just something to be aware of, and the way this isn't something. It's a pretty low occurrence in the general population. If you've had your sister or your mother got breast cancer before the age of 45,
Okay.
this is an indication that maybe there's a genetic mutation.
So in that case, is it wise to look for the gene?
Yes.
Okay.
Yes.
Otherwise, it's, okay.
Yeah. So if your mother had breast cancer and she was 70 when she had it, it's a
Pretty
lower
much like
probability.
everybody else.
Yes.
Okay.
Yes.
And that's, again, nothing we can do about genes except, like you said, watch it and maybe be more proactive.
Yes.
Yeah.
Mm-hmm. Yes.
We still have time. So do you want to talk about osteoporosis a little bit?
I do. I also, before we get off the breast cancer piece, want to talk about breast cancer survival.
Yes.
So the biggest indication for survival is when the size of the tumor when it's found.
Okay.
So the smaller, the better. Maybe
so
we did talk about it. Yes,
we said
thank
the
you.
penny.
Yes, less than sort of the dime size, about a 92% 5-year survival. Larger than 5 centimeters, about 63% 5-year survival. We did talk about it. Sorry.
But you didn't mention. It depends also if it's
spread.
Yes, and that's something.
It's not exactly a linear equation, but the smaller the tumor size, the less probability that it's spread.
Okay. Oh, that's also important. Okay.
Yes.
So again, if you catch it early,
yes,
more chances that it didn't spread and that you can just remove it.
Yes.
Do you necessarily remove all tumors, or sometimes you just use chemo or radiotherapy?
Typically to remove it.
Okay.
Yes.
Okay. And then you assess if you need radiotherapy or.
Yes.
Last week, was it last or 2 weeks ago, I was invited at a cancer center. I don't know if you know this one, the Roy and Patricia Disney Family Cancer Center, Burbank.
Yes.
It's brand new, very nice. It's a little bit the same atmosphere as very friendly, very. So they invited me to talk about, what homeopathy can do for side effects of chemo, and it was very. I think my feeling is that people are getting more open-minded about, a holistic approach. So
yes, there's also we're starting to work with a psychologist who works with. There's something called chemo brain, so that the chemo drugs can impact your brain function
because they're so strong.
Yes, so that's another thing. If you do need chemotherapy, to keep that in mind as an option. The other thing. Radiation is very common with breast cancer. Chemotherapy is less common, part of the normal treatment protocol. But what is interesting is that there's a new procedure called intraoperative radiotherapy, where the radiation is administered during the surgery. And so instead of once, so it's a 20 to 30 minute radiation administered and you're done, versus the standard 6 week
all the problems, the dermatitis.
Yes.
And it's as efficient or
absolutely
even more?
Yes. Same low level of recurrence rates and much more comfortable, improves your
and it's
quality
very
of life.
You told me it's very rare, right? You can't
there are about 50 places in the country that offer this.
And,
yes.
And your center is one of them.
That. Yes.
Right.
Yes.
Kirsten, we don't have a lot of time, so I don't know, maybe we'll tell something about osteoporosis, but I wanted to ask you if people want to know more about the center or get in touch, their website or...
Sure. Our website is lacwh.org.
So it stands for...
Los Angeles Center for Women's Health.
Okay.
lacwh.org. And our phone number is 213-742-6400.
Would you mind saying it again?
Sure. It's 213-742-6400.
And you told me also on your website there's some resources.
There are some tools to help identify your breast cancer risk, your cardiac disease risk, your osteoporosis risk, which is the silent epidemic that women were just not very well aware of. This is basically associated with the significant reduction in estrogen post-menopause.
And loss of bone density. Right?
Yes, which is tied to the reduction in estrogen.
Yes.
And the latest stuff coming out really is that estrogen replacement, low level of hormone replacement, is the best prevention for osteoporosis. About 1.5 million women in the U.S. every year suffer from an osteoporotic fracture. It's the 12th leading cause. Hip fracture is the 12th.
Say that again. What's the number?
1.5 million.
That doesn't sound a lot, right?
It's more than breast cancer, heart disease, all those things combined.
Okay. So you would say that's the main issue for women?
Yes. It's has such an impact on our overall quality of life that about 50% of women who suffer from a hip fracture never walk again.
Yes. And then the health degrades.
Yes. Yes. So the main thing we want to do is keep our calcium up along with our vitamin D, and talk with your physician about estrogen supplementation.
Kirsten, if people want to become patients, do you still you're accepting more
Absolutely.
patients?
Absolutely. Sure.
So same thing, they call and they.
Yep. You can go to our website and we have some of our.
Or you can even do it online.
You can get some of the new patient forms and that kind of
Okay.
thing, or call us and we can email them to you and we can do everything over the phone. Yes.
Do you want to explain where it is again, where the center
Sure.
is, so people don't get confused with the
Yes,
hospital?
Yes. It's in downtown Los Angeles on the corner of Venice and Grand, very close to the 10 freeway.
Yes.
And it's on the campus of California Hospital Medical Center, but in a different building.
But it's part of
It's
California
part of the hospital,
Okay.
yes. Yes.
All right. I think we covered pretty much everything except maybe you didn't tell me if you want to prevent osteoporosis as far as diet. Is there any recommendation? Just
Yes, again,
dairy?
healthy diet.
Yes.
Calcium. So some women who are lactose intolerant and who have
So
not
what do you do?
taken, not had a lot of milk or yogurt or cheese since they were small, this is something to be concerned about as well. But of course, there are other calcium sources available. So the most important thing is to maintain your bone health. Once you've lost a lot of your bone mass, it's hard to recapture it. So
again, you can measure the bone density.
yes, there's a test called a bone mass density exam, DEXA, sometimes how it's called, and this just measures the density of your wrists, your hip, and your back.
Okay, wrist, hip,
Okay. And this is how we can look to how healthy your bones are.
Very good. Thank you, Kirsten. Thank you
Thank
so
you,
much.
Raphaele.
Just so we're going to be back in a few minutes after those important messages. And am I the next guest? Yeah, okay. So I'll see you in a minute.
Hi, this is Elena, inviting you to join me every Wednesday at noon for Elena's Beauty Talk and more, exclusively on LA Talk Live. You can also catch us on iTunes Radio, R&B, or watch us on Ustream.tv. Reality radio, handcrafted for your listening pleasure. This is LA Talk Live, and we are more than just talk.
Hi, this is Dawn Christie inviting you to join me every Friday, 1 p.m. Pacific, for my all-new show, The Dawn Christie Show. Join me as I discuss love, spiritual readings, your purpose, why am I born, what am I here to do. So don't forget to tune in The Dawn Christie Show at 1 p.m. Pacific, exclusively on LA Talk Live. You can also catch us on iTunes Radio R&B or watch us on Ustream TV, reality radio, handcrafted for your listening pleasure. This is LA Talk Live, and we are more than just talk.
Hi, this is Nick Cordelai Corte, inviting you to join me Sundays at 10 a.m. right here on LA Talk Live for our all-new show, People Are Talking. Join us as we offer you a weekly dose of fresh perspectives with in-studio guests, hot topics in the world of politics and pop culture, and the voices of everyday people impacted by the political issues coming to a ballot box near you. So don't forget to tune in to People Are Talking, exclusively on latalklive.com. You can also catch us on iTunes Radio R&B, watch us on Ustream.tv, or even catch us under the Radio Flags app under ILATK. Reality radio, handcrafted for your listening pleasure. This is LA Talk Live, and we are more than just talk.
Joshua Lane, member of the board of directors of Dr. Ann Wigmore's Hippocrates Health Institute, Josh Lane was part of the Dr. Ann Wigmore team that brought wheatgrass, sprouts, and raw foods to a worldwide audience. And now the host of Here's to Your Health on LA Talk Live, Joshua Lane.
We're back. Thank you for tuning in to this edition of Here's to Your Health. I'm your host, Joshua Lane, and you're listening today on the LA Talk Live radio network. And our guest is Raphaele Cohen-Bacry, registered pharmacist, the educator for Boiron homeopathic products. Raphaele, welcome to Here's to Your Health.
Thank you, Josh. Thank you for having me again.
My pleasure. I'm happy you're available. And you are my series regular. Thank you. And so this week we are going to do homeopathic remedies for sinus pain. Is that right?
Exactly. Yes, it's a very common problem. Usually it happens after a cold or an allergy flare-up. So it's not really the season for colds right now, but we're getting to fall. Yeah, some people are getting sick, but allergies definitely it's the time of the year when it's coming back even more. And so basically what happens, we have sinuses in our face. They go by pairs. And we have four major pairs of sinuses. One is in the forehead. The biggest one are around your cheekbones and behind your cheekbones. One around your nose and behind the eyes. So they're just hollow cavities. Mm-hmm. They're just empty. We don't. It's very interesting when I do my research for the show. I'm always amazed that there are so many things we still don't know, we still don't understand really why we do have sinuses. So apparently it's kind of a way for the brain to be insulated from all the noises we're making when we speak and chew. So
really?
Yeah, so that's why it's empty cavities. Also it's layered with a little bit of a mucous membrane that secretes some mucus, and this is to it's like a barrier against allergens or viruses. So when there is an attack, that it's going to secrete more mucus to try to flush out any kind of harmful particles or things like that. The other reason why we have sinuses is to keep the air moist, because the way it works, all the sinuses are connected to our nose through little canals. And so when we breathe, the air goes through the sinuses, and apparently, especially when the air is very dry, it's not really good for us, so it helps humidify that air. So that could be also a function of the sinuses.
I did not know.
But yeah, it was very interesting. But I'm explaining that just so people understand that all those pockets are connected to the nose, and they need to be able to drain to function properly. So when we have a cold or an allergy, this is just normal reaction. The mucous membrane in the nose gets swollen, irritated. There's inflammation reaction. The secretion of mucus for the same reason, to flush out the virus or the allergen. And so what it does, it blocks those little canals, and the sinuses cannot drain properly, and they're blocked, and that's when we have pressure in the sinus. And that's why, I'm sorry, I'm taking a little bit more time, but it's interesting to understand why, when you have a cold, sometimes you have sinus pain, and it's not the cold is over, but you get those pain pressure very often behind the eyes. It's very, very tender. You get what we call sinus headaches. And the difference, a lot of people think they have sinus headaches, but it could be a regular headaches. To really qualify for sinus headache, you have all those painful areas. My brother, who's a physician, when you complain of sinus, I think I have a sinus problem, it just presses, on your cheekbones or on the... But it's so strong that it's painful anyway, so it's not good. You don't have to. You just touch a little bit of pressure, and if it's tender, if it's swollen, there's something wrong with your sinuses. Also, very often a little bit of postnasal drip, That's often irritating. That's why people often cough and have sore throat along with the sinus pain. So what you don't want to leave that untreated. Although for a lot of people it goes away, but people who have a tendency to get sinus infections, they should really act early on, because if you leave this way, bacteria are gonna develop on the mucus that you have in your nose, and they're gonna lead to sinus infection, which is a serious condition. And that definitely, if there's a sign of infection, you need to go and see your physician. So you want to open up, the nose and the sinuses, so you don't get an infection, which is the sign of infection. It's usually the pain is much more, it's much higher. You have your fatigue. The general state is not good. It's very hard to blow your nose, but when you do, usually you drink, there's pus, and so that's, if we can avoid that, that's better. And the advice I'm going to give, you can still, use them, even though you have to go to see a physician, maybe get some antibiotics or something. But still, our medicines are gonna help greatly for any kind of pain.
And do we know why we get these sinus infections? Is there
some people
couple of
are
reasons?
Yes. Well, you can also, sometimes you're just a little bit weaker and you're going to develop an infection a little bit more. But also, people who have sinus problems, sinuses don't get fully developed before 20 years old. So
really,
so younger
my
people
goodness.
have smaller canals, and so kids get a lot of sinus problem. Not necessarily infection, but a lot of pressure in the sinuses.
Excuse me, Raphaele. Where did you get that information at age 20?
On maybe no, it was a.
And you are a registered pharmacist.
Yes,
you graduated school.
I'm pretty sure it's accurate. I might be wrong.
No, it sounds great. I just had no idea.
Me neither, but that's why I can check it out. But I read it in 2 different places, so I think it's pretty accurate. But also people with a deviated septum.
Caused by what? Injury?
Well, it can be just the way they were born. It's just, a lot of people have that. It's the septum, the wall, that's a little bit deviated, so it blocks the nasal passages. So again, breathing is more difficult. The drainage is not as good. Polyps also can promote that kind of issue. So there are some reasons like that, like morphological reasons, or some people have weakness, and for some people it's going to be sinus issues, and other will never get it. But definitely people with allergies, frequent allergies, they very often suffer from sinus pain. It can be pretty intense. I read somewhere, I don't know where, but I read that 37 million Americans suffer from sinus issues each year.
Yeah, sure.
And it causes a lot of missing work day, and it's just not pleasant. It's very hard to focus and think when you have the head is really heavy and it's hard to breathe. So it's a
and these problems occur there from environmental pollution, or are they dietary, or they're a combination?
I'm sure diet, apparently diet is involved in everything, but I don't really know what triggers, what kind of, maybe but I'm not sure. If there's something you should avoid, just observe what you eat and see if something is triggering a sinus issue. But I'm not too sure about that. I think it's really beginning of a cold, and people usually know when they get a cold, they know they're going to have a sinus problem. So.
And of course, the cigarette smoker, we're more prone to that.
Definitely, alcohol is not good. Also.
Alcohol problem for the sinuses.
Yes.
No, did not know.
And everything that can irritate the mucous membrane, like I didn't think about that.
Yes, right, yes.
But even the pool, the chlorine in the pool is very irritating to the mucous membranes. So that's something you should stay away from. And there are things you can do to help. A little tip that I really like, and that's so easy. Even as simple as a little cup of water next to your bed at night, when it's very hot. Like lately the air is very dry here, or in the winter when the heater is on, the air is very dry. And what you want to do at all time, you want to keep your mucous membranes really hydrated. And some people, don't know that because of all the mucus and the runny nose, that they just want to have a nose that's dried and
Right.
clean. But if you dry your nose more, it's going to do the opposite. The mucous membrane is going to produce more mucus just as a reaction. So you always want to hydrate. So a cup of water. If you want to put a few drops of eucalyptus essential oil, it's very good. In Paris, I used to do it. Here, I don't think you can do it. But when you have the heater on and you can put something on top of it, very good to put the water there because it's going to evaporate and humidify the air. Nasal irrigation, very good. I'm not too much a fan of the neti pot because just it's hard to keep clean.
It is hard to keep clean.
Don't use the tap water. That's something you're gonna put in your nose. You want something distilled water or sterile water. I think it's just simpler to get those saline spray, and it works just as but that's to each his own. But that's more my.
Yeah, the neti pots are popular the past couple of years, aren't they?
They are, they are all over the place. But I don't know. But anyway, that's a good thing to do. Inhalation are good. Again, for the same reason, drink a lot of water. I like warm broth because they tend to loosen the mucus also, so it's easier to but because that's what you want to do. You want to get rid of the mucus and the swelling of the mucous membrane so your sinuses can function better. So warm compresses on the face, apparently it helps some people also.
Yes, I know a person that actually does help. Yes,
it's
a great ancient remedy, isn't it?
It is, and it's why not? Because people are really in pain. I know my niece is very prone to that, and she travels a lot. So also in the plane it gets even worse, the pressure in the sinuses. So
from being 30,000 feet in the air.
Yes. So if you can clear up your sinuses before it's good. The usual treatment, they do work, but a lot of side effects. People are going to take steroids or even the nasal spray, the decongestion. They're good, but you know about the rebound effect.
No, tell me, I don't.
So what you do with the spray, for example, decongestion, they clear up your nose and you can breathe. But when you stop the treatment, and usually you shouldn't take them for more than 3 days, but even 3 days or even a little bit more, it's going the problem is going to come back with a vengeance, even more. That's what we call the rebound effect. So it's worse after you stop than before. So you got relief, but it's not a lasting one. So that can be a problem. And again, a lot of steroids, obviously, they depress your immune system. So if you happen to have an underlying infection, this is going to be much worse. So you really have to assess if you need those, or sometimes you need antibiotics, sometimes you don't, but still some physicians prescribe antibiotics when it's a virus problem.
And so if it was a virus problem, the antibiotics would be wrong therapy.
Yes. I know some doctors still like to give antibiotics in case there's a later infection with the bacteria. I don't think it's better to really give it when you did it.
Excuse me, how can you tell if an infection is bacterial or viral?
That's not I couldn't answer.
Is it a judgment call on the part of a physician?
Maybe, I don't know if they can do some tests, maybe, or maybe they know that there's a virus, going around. So, in the community, that might be a good indication, or if it's more bacteria that's around. Okay. This I don't really know, but in any cases, it won't work. So even if you take antibiotics, but it happens to be a virus, you won't get rid of your problem anyway. So there is a homeopathic medicine that you can take anyway, infection or not, because it's going to help with the pressure and the pain. And if you need to, address the infection, that's going to be your physician's prescription. But
should we hold that thought 1 second? For those of you just tuning in to our show today, Here's to Your Health on LA Talk Live. We're speaking with Raphaele Cohen-Bacry, registered pharmacist, who is the educator for Boiron homeopathic products. I just wanted to jump in and say that. So what do you have? This is some products that are specific for sinuses. from boron?
Yes, there are several ways to address sinus pain, sinus pressure with homeopathy. I always like to talk about the easiest way for your listeners who don't necessarily know too much about homeopathy. They just want a natural solution that's, without side effects, and that's a very safe way to address the problem. So this is what we call a combination medicines, meaning that we put together several homeopathic medicines to address several symptoms. So it's easy. It's easy for you. You just, it's OTC medicine, so meaning you don't need to see a physician. And it combines, this one is called Sinusalia. So it's easy to know that it's for sinus. And like it says, it's for congestion and pain related to a sinus problem, sinus headaches. And it comes in tablets or pellets. Tablets, we recommend it for children 12 years old or older and adults. And we like pellets for younger kids, between 6 and 12. The reason why we said 6 and not, smaller, although it'd be harmful, but little kids, it's more difficult to get the symptoms and more difficult to have them explain what they feel and what the problem is. So we don't want, maybe there's something else that you cannot see. So it's better to see the pediatrician. That's why we put an age limit of 6.
Oh, I see. Okay.
That's almost.
All right, that seems smart.
It's almost always the case. The age limit, it's more because it's an over-the-counter medicine. We don't want people to bypass the pediatrician. And although the medicine is totally harmless, but they're going to delay the visit to the pediatrician, and maybe more problems are going to occur. That's why we put that age limit.
Yes. Also, please, on these homeopathic products from boron, they are regulated by the Food and Drug Administration.
As drugs.
As drugs,
yeah.
Which is why you can make specific claims for them. They are regulated as drugs by the Food and Drug Administration in the United States.
Yes.
Okay.
And that means the the consumer knows that it's a controlled product. That's everything is controlled from for example, the plants or the minerals we're using. So everything is scrutinized from the source to the product. Labeling is regulated by FDA. We have to comply to a whole bunch of requirements. So it's good for the patient. They know they're using something that's clean, in all levels. On top of that, we don't put all our medicines are white, so no dye.
Yes, right, no dye, right?
No dye, so no allergies related to the dye, no flavoring, nothing. Everything is from nature, and just, a little bit of inactive ingredients, and that's all we put. So of course, no decongestion, no antibiotics, no all the usual medicines.
And of course, you were trained in France as a pharmacist, and in France, homeopathic products are widely used.
They're even reimbursed by the healthcare system. Right. So they're really considered as regular drugs. Right. And I always explain that, it's very common for, in France, and I'm sure in other European countries, on the same prescription, you have, medicines for your heart or, and then if you have a cold, they're going to put, homeopathic medicine for the specifically because they know they won't interact, for example, with the heart medicine.
Sure.
So it's, it's efficient, it's safe, and here it's OTC, so it has to be very safe because we know people are going to, grab it from the shelf without seeing a physician. And so this specific medicine, it combines 3 homeopathic medicine. They're all for sinus pain, but a little bit, different indications like belladonna. It's really for the pain. It's very tender when you touch the area where your sinuses are. It's usually you have a sensation of heat, like almost it's a little bit red, and the nose is mostly blocked, so you can't really breathe. There's a second one, which is I believe a sanguinaria, which is also sinus pain, but that's going to be more with secretion, so the nose is not as blocked, it's more secretion of mucus. And the third one is specifically for sinus pain with postnasal drip. So we put those medicines in order for the sinusalia to work on different cases. So it addresses almost all the kind of sinus problems you can have.
And the homeopathic, I find that the description of the symptoms that the product works on seems so very specific, and this is all based on clinical observation over the
empirical observation for 200 years. Now we have more research to back it up, but that's originally how it started. Just observing what a substance in nature would cause on a healthy individual, and reversing it, and knowing that the homeopathic dilution made from that substance would treat those very same symptoms, and of course checking it works all the time. So it's a very empirical method at the beginning, but that's how they built a lot of experience. It's 200 years of experience and reliability, and it works. It's very interesting. But there's also so that's the sinusalia easy way. That's what I would go for if I don't know too much. There's another way to be a little bit more accurate, and it's just to give you an example, because we have a lot of medicines for sinus issues. But
you mean Boiron does, or
homeopathy and Boiron? Yeah, that's what we call those. I don't know if you can see it, but that's what we call the single medicines. So here, as opposed to sinusalia, it's only one strain, one medicine. So this is Challem bichromicum. It's a
what was that one again?
Challem bichromicum. It's a potassium salt. So homeopathic medicines, and I have two other medicines, but it's just to show you what a good homeopath would do if you have a sinus issue. For example, if you do have secretion, if you do have mucus, because sometimes you don't, right? It's all blocked. But if you do, and that we're not used to that, with a regular physician, but a physician who has been trained in homeopathy, or even a pharmacist who knows, they're going to ask you, okay, so you have, mucus, what does it look like? So the first time you're like, well, I don't know. It's I don't look. A lot of people say that, but it's important to know: is it watery? Is it thick or greenish? Is it very burning, or do you have post-nasal drip? And according to all those different signs, they're going to be able to determine which medicine is going to really be just for you. You Josh, you have a sinus problem. This is the medicine for you, and it's not going to work necessarily for me. Maybe it will if I have the same symptoms, but if my nose is blocked, I have no mucus, and this is not going to do anything. It's not going to do any bad, but it's not going to work. And it's very interesting, because when you really know the medicine, it works really very well and quicker. So those are three medicines. For example, Challem bichromicum. This is very efficient, very typical of a thick secretion, greenish, sticky. The nostrils are excoriated. It's painful.
Actually, now this description of mucus. If you're working with a client the first time, are they squeamish by your questions, and after they recognize the questions, they kind of relax into it? Is that it?
Well, I don't see patients. I give advice to my friends.
When you saw patients in Europe.
Well, very often people who go and see a homeopath, they're open to it, obviously, right? Yes. So you have those people, they're taken care of, and then you have people who are very happy because they tell you, I always want to explain what I feel, but physicians are not interested. Usually, you have sinus problem, this is what you're gonna get. You have a cold, this is what you're gonna. But they're very right, they love to explain, because they know there's a difference. Maybe they got a sinus issue 2 years ago and it was very different. So it makes sense to treat it differently according to the symptoms.
It certainly does make sense, doesn't it?
And some people, they're not ready for it. They want their antibiotics. And so the doctors I know in LA, they tell me, except for a few that are strictly homeopathic, but others tell me, I just ask my patients, are you open to a more, holistic approach? And if they're not, we just go the regular route, and that's fine with me too. But if they're open to it, a lot, like we said last time, young parents are usually very open to homeopathy because they love the idea that they're not going to harm their kids,
Yes.
So that's a great way also to be introduced to a more natural approach.
Well, That sounds very good. And our guest today on Here's to Your Health has been Raphaele Cohen-Bacry, registered pharmacist, the educator for Boiron homeopathic products. And how do we get in contact with Boiron? How do we
You
contact
just
them?
go on the website. There's a lot of trainings also for people who want to learn for themselves. And the website is www.boironusa.com. And Boiron is B as in boy, O-I-R-O-N as in Nancy. So it's boironusa.com.
Raphaele Cohen-Bacry from Boiron Homeopathics, thank you for being a guest on Here's to Your Health. We are going to take a short break, and we'll be right back after these important messages.
Mountain Valley Spring Water, since 1871, has been bottled at the source in Hot Springs, Arkansas. Twice named the best tasting water in the world, Mountain Valley water is naturally alkaline and bottled in glass, providing the perfect blend of nature's minerals, giving you a crisp, clean taste. To start your home and office delivery in Southern California, call us at 1-800-499-9982 or visit us online at www.mountainvalleywaterla.com. New customers will receive their first 2 5-gallon bottles free. Mountain Valley Water, the official sponsor of Here's to Your Health with Josh Lane on LA Talk Live.
Walk, run, climb, play. Solgar number 7 can help. Feel the difference for yourself. Solgar number 7 actually shows improvement in joint comfort within 7 days. Now you can start to get back on track fast and pursue the activities you love. Solgar number 7 is a breakthrough in joint care with no glucosamine and no chondroitin. The advanced bioactives in Solgar number 7 help to increase flexibility, mobility, range of motion, and actually shows improvement within just 7 days. 1 capsule once a day is all you need. When stiff joints occasionally say no, Solgar number 7 says yes. Visit Solgar.com and learn more about Solgar number 7 today. That's www.solgar.com, www.solgar.com. Solgar number 7, official sponsors of Here's to Your Health with Josh Lane and LA Talk Live.
Joshua Lane, member of the board of directors of Dr. Ann Wigmore's Hippocrates Health Institute, Josh Lane was part of the Dr. Ann Wigmore team that brought wheatgrass, sprouts, and raw foods to a worldwide audience. And now the host of Here's to Your Health on LA Talk Live, Joshua Lane.
Thank you for tuning in to this edition of Here's to Your Health. I'm your host, Joshua Lane, and you're listening to us today on the LA Talk Live radio network. Our guest today is Jack Challem, who is a well-known author of books on wellness, and Jack actually has three important new books out within the past year. One is called No More Fatigue. One book is Stop Prediabetes Now, and of course an excellent book called The Inflamation Syndrome. And Jack Challem has been an author and a recognized authority for probably 25 years, maybe even longer. And I've been reading Jack for a very long time, and I'm very pleased that he was available today to call us by phone from his offices on the East Coast. Jack, are you there?
Hi, Josh. Yes, I am.
Very good. I appreciate you being on Here's to Your Health today. And I noticed that your new books seem very contemporary in orientation. That is, the whole idea now that inflammation is a major indicator of illness.
Yeah, I think this was really the first book on the subject. The first edition was published in 2003. I updated it a couple of years ago, and our own bodies have the ability to control inflammation, basically the itis diseases. As long as we are eating the right foods or taking the right supplements. Mm-hmm. And, foods and supplements are really the building blocks for healthy biochemistry.
Yes. That's a concept that I think enjoys wide currency today in 2012, but was not as acceptable in, say, the year 2000 as it is now.
You're right. And some conventional doctors are still kind of resistant to it. And the way I frame it is everything in our body really comes back to our biochemistry, including our genes and how our genes function. And so does this biochemistry come out of thin air? No, it doesn't. It really comes back to the foods we put in our mouths. Mm-hmm. And if we eat junk foods, then we're going to have junk biochemistry and junk health. And if we eat good foods and take the right kinds of supplements, then we're going to have optimal health.
Yes. Once again, that's a concept that many of us agree with now, and that most people didn't really know even 10 years ago, but people do kind of accept now that no matter what your genes are, that nutrition is a factor in promoting good or poor health.
Yeah, and one of my other books was called Feed Your Right, and basically the underpinning of our genes. This surprises a lot of people, including scientists. But our genes are really built on nutrition.
Yes.
And whether they work as nature intended or whether they misfire, so to speak, comes back to, again, what we're eating or what we're taking in the way of supplements.
And Jack, are you finding that these ideas in the scientific community, that there's more and more research being done to support them?
There is. And I don't want to get too arcane or obscure here, mm-hmm. but there's a field of genetics called epigenetics. And this looks at the many things in our environment, including our dietary environment, that turns our genes on or off. And vitamins are a big player here. Folic acid, as one example, a B vitamin, turns off many of the genes involved in cancer. So the research in this area is moving ahead very, very quickly, and there is this nutritional backdrop.
And if you can make a broad recommendation, how much folic acid do you recommend for the adult male or female?
I would recommend it as part of a multivitamin supplement. One of the brands I like is Solgar's VM75.
Yes, I like Solgar VM75 myself. Yes, I find people really enjoy, feel good on that product. Yes, I do.
Yeah, but taking folic acid by itself, in moderate amounts is okay. Larger amounts. Probably, it would be good to consult a nutritionally oriented doctor.
Mm-hmm. And besides folic acid, what about the use of B6 and B12? Aren't those three sometimes used together successfully?
They often are, and they are involved in this process called methylation that helps turn genes on and off. But for most people, I would just recommend taking a high-potency B-complex supplement. Mm-hmm. And all of this good stuff will be in 1 or 2 capsules a day.
Yes. And now B vitamins, folic acid, those have been studied and used for a long time. I noticed in your books the discussion of coenzyme Q10, which does seem relatively new on the scene, not scientifically so much, but in popularity. Can you comment a little on how much CoQ10 you'd like to suggest?
Well, I take 200 milligrams a day of the ubiquinol form of CoQ10. The whole CoQ10 story is interesting because the 1978 Nobel Prize in Chemistry was based on CoQ10.
Oh, I see.
And CoQ10 is involved in firing up the energy centers of the 70 trillion cells in your body, my body, and everyone else's body. Without CoQ10, we die. Simple as that.
Wow. And the ubiquinol form is in based on your science, it's just better absorbed than the earlier forms of CoQ10?
Yeah, it's better absorbed, and I think when you look at the source of CoQ10 products, I think the marketplace can be a little bit crazy, but I think the ubiquinol form is generally a higher quality product.
I noticed that when specifically talking about the Solgar ubiquinol, that they have a stamp on their product that says Kanaka. Is Kanaka the Japanese raw material supplier?
Yes, it is. And they also supply regular CoQ10. But one of the problems in the marketplace, as I'm sure you know, is there are a lot of discounters, and they're getting plain old CoQ10 from China, which I think is of dubious quality. And Kanaka has the patents and the process, at least at this point, governing the production of ubiquinol. So I think it's a more reliable and better absorbed type of CoQ10.
Now, speaking about Solgar, they have their own in-house laboratory and PhDs to analyze all their raw materials. Is that not correct?
Yeah, and I've been through the facility. It's really pretty amazing. And, speaking of their products, they introduced a new product recently called Number 7, which I'd love for us to talk about for a few minutes.
Yes, please.
Over the years, I have seen so many products, and there are very few that I would actually describe with the word elegant. But this is a truly elegant formulation. And, when you hear the number 7, you think of rolling the dice and winning.
Yes,
lucky
that's right.
number.
Yes.
You think of the Magnificent 7 in that old Western movie. And really what the product is about is 7 ingredients that, according to the label, shows improvement in joint comfort within 7 days.
Yes.
Now, this is based on solid research. It certainly has gotten past the lawyers to make that kind of claim. And one of the other things I like about the whole packaging of this product is it takes a positive spin on things, and it goes beyond the old glucosamine chondroitin idea and talks about joint support and comfort, increased flexibility, increased mobility. So it's more of a positive spin on the aches and pains a lot of people complain about.
Actually, I had a stiff back about 3 months ago, from lack of exercise and driving around in the car too much here in LA. And I got a sample. I started taking it, and I was impressed. It actually helped me. I really thought, oh, my back got much better in like 3 or 4 days. I thought, oh, my back is better. I was very happy with the formulation.
Yeah, and the 7 ingredients really start with vitamin C, which is basically needed to make collagen protein, which is the principal protein in our body. One way to look at it is it's the glue that holds our body together. And second ingredient is 5-loxin advanced, which is an extract of the herb boswellia.
Mm-hmm.
Third ingredient, turmeric root, also known as curcumin. I'm a big fan of turmeric root. I use it in my cooking. I take it in supplemental form. Next ingredient, UC2 standardized cartilage. This also is involved in rebuilding the cartilage in joint. White willow bark. This was the original source of aspirin. And a lot of people can't take aspirin, and willow bark, has kind of a softer, gentler approach, and most people do not have negative reactions to it. Ginger root, one more ingredient. I mean, it's both a food ingredient and an herbal supplement. And then finally, pepper spice complex, which, among other things, includes bioperin, which helps absorption of all of these other nutrients. And so here are 7 reasons combined for why I think this is an incredibly elegant product. Again, it's called Solgar number 7.
And this Solgar number 7 product, you did mention turmeric, and turmeric seems to be successfully used for many problems, including problems with, is it not used also for Parkinson's patients?
It has a wide variety of uses, and part of it is because it works as an anti-inflammatory. And every disease process, and I go into this in my inflammation syndrome book, every disease process has an undercurrent of inflammation. And so an ingredient like turmeric root dampens down that inflammation. And whenever people are dealing with pain, inflammation is a major component. Just a little bit of the science. There was a review article published a couple of years ago, and what the researchers showed and documented in a very long list was that turmeric root extract blocked 97 different biochemical pathways involved in inflammation. I can't think of anything else that has that kind of broad spectrum benefit.
And so, may I ask, this number 7 formulation from Solgar, the scientific team at Solgar did the research and put this combination together. How was this formulation derived?
I don't know the details, but I can tell from the concept that a lot of work and a lot of thinking and a lot of research went into it.
Mm-hmm.
And again, there are very few products that I would describe as being elegant in formulation. And this one would probably be at the top of my list. And, Josh, I've been in this industry since the dawn of time, practically. And so I've seen a lot of products, and this one really stands out.
Well, Jack, actually, I think you have been in this industry since the dawn of time, because I believe I've been reading you since probably 8:30 in the morning, dawn of time. So very early on, I started reading your articles. I remember you had many articles, and later on, the important books. What about, I mentioned in the 3 books that I have on in the studio, you also mentioned the work of Bruce Ames. And Ames seems to pop up as an influential researcher in many nutritional studies. Why were you quoting him in your book?
Well, he's one of the top cell biologists in the country. And he's gone through an interesting change, because when I first met him, I was reading his papers, decades ago. But when I first met him around 1995, he was actually anti-vitamin supplement.
Yes, I remember.
And and then about 7 or 8 years ago, he and his team did some research, and he did a 180-degree turnaround. And a lot of his research focused on coenzyme Q10 and carnitine in the aging process, and how these two nutrients could slow and to some extent reverse the aging process. So I think he has done some amazing work. He also did a very exhaustive scientific paper that I think ran about 50 pages, in which he really looked at how nutritional deficiencies impact a wide variety of diseases, most of which are not generally thought of as nutritional deficiency diseases. And he went into the science, of course, and made the point that all of the biochemical processes that occur in the body really rest on a foundation of vitamins and minerals. And when you don't have enough vitamins or minerals in your diet, these processes start to slow down or stop. And when they slow down or stop, we get sick.
And so that does seem. Then now, is that a concept that is widely recognized today?
It's catching on slowly. I think the nutritionally oriented physicians and naturopathic physicians understand it. The conventional doctors I run into, unfortunately, they still seem a little bit clueless about it.
Well, unfortunately, I hate to. Yes, they do seem clueless. Now, were there any particular illnesses that caught Dr. Ames by surprise when he realized there was a nutritional component?
You know, a lot of them, I can't recall the list of diseases. It was pretty long. But a lot of them were related to deficiencies of B vitamins.
B vitamins.
And what I can, and what I can tell you from what I've read in the literature, we were talking about folic acid and B12 before, and deficiencies seem to impact memory. Deficiencies seem to increase the risk of Alzheimer's disease. Deficiencies seem to increase the risk of cancer. And, you know, when you look at the B vitamins, I mean, this is really a family of 11 different vitamins.
Yes.
And, you know, when you're dealing with 11 vitamins instead of just one, it's going to have broad effects on health. And all of the Bs, as just one example, are involved in energy production. And they essentially work in tandem with coenzyme Q10 and carnitine. And so, you know, if people just feel tired all the time, if they had come to me for a nutritional consultation, I would likely recommend a high-potency B-complex vitamin to start.
If a person came to you for a consultation about wellness and you recommended a B-complex vitamin, are you taking the position that when you recommend a B-complex vitamin, really almost all the people who come to see you will benefit? Is that it's like sleeping 8 hours a night? Is it that basic?
Yeah, it really is that basic. And when you look at the data published by the U.S. Department of Agriculture, almost everyone in this country is suffering from at least one vitamin or mineral deficiency. And roughly somewhere between 25% to maybe 35% are deficient in at least one B vitamin.
Excuse me, Jack. Is that a government statistic?
Yeah, this is from one of the U.S. Department of Agriculture websites.
I see. I see.
And so basically, we've got over 300 million people who are walking wounded.
Yes.
And they're suffering from multiple vitamin and mineral deficiencies, and they don't even know it. And people, right now there's a lot in the news about vitamin D, and 3 out of 4 Americans are deficient in vitamin D.
Yes.
And it's certainly my hope that this is kind of like the gateway to conventional medicine accepting more in the way of nutritional benefits and nutritional therapy.
Yeah, it is possible. Wasn't folic acid the first nutrient that the U.S. government allowed nutritionists to make claims for, that it prevented neural tube defects, that is spinal bifida? Was it not folic acid?
Yeah, it was folic acid, and this came out of studies in Ireland. This, I think, goes back to the late 1970s or early 1980s. And since food has been fortified in this country with folic acid, the incidence of spina bifida and other types of neural tube defects has decreased.
Oh, I
and
see.
there have been some other benefits as well. The incidence of some childhood cancers have decreased since folic acid was added to food. In some cases, there's evidence that behavior issues have decreased following the food fortification of breads and other foods with folic acid. I mean, that's just one nutrient.
Yes.
Imagine if people were fortified with, all of the 30 or 40 nutrients that are deemed essential.
Yes, that does seem remarkable, and also it would be very cost effective.
Yeah, and then you get into some economic issues, and whenever we talk about things being cost effective or saving money or reducing medical costs, someone else is going to lose income.
Yes.
And so the bitter irony here is there are a lot of forces that are profiting from illness. I mean, hospitals don't profit from well people, they profit from the sickest of people.
And Jack, that statement, that is, I guess some people would find that a somewhat of a harsh statement, but do you think that is one of the reasons why the whole wellness idea, that of exercise, of eating carefully, of a cleaner environment, doesn't enjoy more support?
I think it's part of the reason, and one of my best friends, a physician, sort of framed it this way, and he said instead of talking about health care, we should be talking more about self-care.
Self-care. Mm-hmm.
And just taking better care of ourselves instead of kind of like not taking good care of ourselves and then at some point down the line expecting someone else, doctors, hospitals, insurers, to fix us.
Yes, and I think that, Jack, if you and I live long enough, and I think we probably really will, I think we'll see these ideas become absolutely mainstream as they kind of approach that now. Jack Challem, how can listeners contact you?
They can go to my website, nutritionreporter.com. They can email me through the site, and on the site I've got excerpts, a couple of chapters each from my recent books. I've got a full year's worth of my newsletters up, free for the download. And so there's just a lot of great free information. And yes, I do publish a monthly newsletter.
And what's the name of that, Jack? What's the name of that newsletter?
The Nutrition Reporter.
And how can people get a copy of that, which, by the way, I'd like to go on record as saying is a very good publication?
Yeah, I've got 12 issues up on my website that can be downloaded for free in PDF format. There is subscription information up there. The newsletter does go out the old-fashioned way. It's printed and mailed.
It comes out by horseback?
It's printed and mailed. It goes out the old-fashioned way.
Yes.
And what I do is cover late-breaking research on vitamins and minerals, foods, and herbs.
Yes, and Jack, we're speaking today with Jack Challem, a nutrition author. Jack, your new book, No More Fatigue, and the book The Inflammation Syndrome, and also the newer book, Stop Prediabetes Now. How can listeners obtain copies of those books?
Well, they can get them from Amazon, or they can go to my website, again, nutritionreporter.com. And there are links to Amazon from my site. And there are a couple of sample chapters from each of these books up on the site, so they can sort of preview before they order the book.
Jack, I'd like to thank my guest, Jack Challem, nutrition author, for being a guest today on Here's to Your Health. I'm your host, Joshua Lane, and you're listening to us today on the LA Talk Live Radio Network, and we'll be back next week at the same time to answer your nutrition questions. Thanks for tuning in.
For more information about the guests and sponsors of Here's to Your Health on LA Talk Live, please call us at 818-707-0005.
You are now tuned into LA Talk Live. We're more than just talk. Don't go anywhere. Stay tuned.